This week, President Joe Biden outlined his pandemic plan as we head into the winter months here soon, as a new variant is causing concerns from health officials all around the country.
Right now, CBS's Margaret Brennan from Face the Nation joins us live from D.C. to break down the latest developments in the ongoing COVID-19 pandemic. As always, Margaret, it's very nice to see you on this Friday afternoon. We want to start with this new variant, Omicron. How is the White House responding to this variant while managing surges with the Delta variant?
Well, the Biden administration is saying there's no need to panic. They believe that the tools that they have in their toolbox are effective, but they aren't quite sure about that. That's why they're asking healthcare professionals and people at home to take the kind of protocols you're familiar with. Mask wearing when you go through federal transit points like airports, that's going to be mandated through March. Things like calling on the public to take a test at home. They're trying to encourage the public to sort of self-police there and making it more affordable by having insurance companies reimburse you. That'll be policy as of January. So these are changes to many of the things the public is familiar with, but making it more affordable or easier. The president has made clear two things. One, he said no more lockdowns, and two, he wants to keep schools open. That's why he's asking the CDC to do a test to stay guideline that would avoid mandatory quarantines after COVID exposures for all children. So there are some tweaks here. We're going to have the Surgeon General explain them, answer some of the questions people at home might still have. But those big ones about just how transmissible this new variant is, Omicron, we still likely won't know for weeks to come.
Reported now in 5 states nearby here to Oklahoma, as close as Missouri now. Margaret, how is the World Health Organization responding to this new variant, particularly in countries, too, in South Africa, where this variant was first discovered?
Well, the World Health Organization, as we have learned through this pandemic, is only as good as the information provided to it by governments. And that is the difference. South African scientists, within 36 hours of their detection of this variant, called the World Health Organization and told them about it. Well, that's why this sort of bat signal went out across the world. That's the opposite of what happened when the pandemic began, when the Chinese government and Chinese scientists didn't share that information swiftly enough, and it had already been transmitted. So we want to ask some questions of whether the world is better prepared this time, what the lessons have been, but also just what the information is that the WHO is getting from those scientists in South Africa who are working to get those answers about whether these mutations on the spike protein, for example, actually enable it to pierce some of the treatments we have. How transmissible, how virulent, all these things are big looming questions, and we're hoping to get some answers.
Yeah, certainly when it comes to Omicron, there's much more to discuss. Margaret, always great to see you. We hope you and your family had a great Thanksgiving, and thank you for your time this afternoon. And of course, we will be watching, as we do every weekend, Face the Nation Sunday right here on CBS.